Good morning and welcome to the WellMed Charitable Foundation's Caregiver Teleconnection. Today, we're doing the last of our series on Health is Our Wealth promotion program for caregivers, that's going to be on stress management today. And we have our experts, Lucy Barylak and Elliot Sklar. Dr. Elliot Montgomery Sklar is a public health professional focused upon supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, the United States, and virtually. Dr. Sklar is an associate professor of healthcare sciences at Nova Southeastern University in Florida. He publishes and presents his work internationally, and that work is focused on the complexity of issues related to aging and caregiving. Now, Lucy Barylak has a master's degree in social work from McGill University. She's presently working as a consultant for a health network in Montreal, Canada. She's been involved in various research projects and has published numerous articles related to caregiving issues. She has lectured at several universities and colleges on innovative approaches to caregiving, and she presents annually at international and national conferences. Lucy is also a consultant for private industry in the United States, including her work with the WellMed Charitable Foundation and their clinics in Texas. In addition, Lucy would like you to know that she was a caregiver for her mom for about 10 years. And with that, we're so happy to have you, Lucy and Elliot. Welcome. We're so pleased that you're here today.
Thank you.
Thank you. Thank you so much. So our series this month, as you mentioned, has been called Our Health is Our Wealth. And it's a series to promote the health and well-being of caregivers and also care recipients. So why are we ending this series by discussing stress management? It's because in the context of health, stress has many implications. Stress can result in health problems, and health problems can also be quite stressful to deal with. We also really believe in a prevention approach, which is again why our series has included a focus on nutrition, on physical activity, on mental health, in addition to today's program on stress management. So I mentioned this last week, but there's an old saying that stress is really just dessert spelled backwards, because many of us actually really want sweets when we're stressed. And I joke often that when I'm buying hurricane supplies, there are never any cookies left, but there are always rice cakes. I guess humor is the way that I cope with stress, but I also use physical activity. When my husband and I first bought our house and we're in the process of relocating from an apartment that we had rented for 8 years, I was at the gym 7 days a week, including the morning of our move. And it was really only for my mental health and to help me cope with the stress. The annoying part, though, is that I didn't lose a pound because I was eating all those desserts, but that's a whole other story. So I know how much the topic of desserts has been something sweet that many of us have enjoyed talking about. So I did include a link here at the bottom of our screen for some easy recipes for low calorie and low sugar desserts. Now, many of you have enjoyed sharing about food and beverages during this series, from sparkling water to hydration supplements and sugar-free items. So I wanted to ask all of you if, for you, stress backwards spells desserts, and have you found there to be any connection between your caregiving stress and your weight or your diet?
Ooh, big question. If you're on the phone, press *6 to unmute yourself. And if you're on Zoom, you can unmute yourself, or you can go on chat, or you can put your hand up. And I have a little website, and we have Griselle that would like to talk to you.
Hi, everyone. Thank you for the invite. I'm a social services manager at the Brain Center. We're a neurology practice, so we do see a lot of patients, obviously, with Alzheimer's and dementia, and we have a course that we develop with FIU, managing Alzheimer's and dementia, which is designed for the caregivers. One of the reasons why I wanted to join this series was to learn more, have more information to share with our caregivers, especially around stress management. So thank you for having us. Having me, I'm sorry, and being part of this. Um, I do see or hear a lot of feedback with caregivers in regards to the weight. And I actually there was a new patient here yesterday that told me before she left, can you believe I weighed more than her? I've gained like 10 pounds. And I don't seem to know why, because she eats more than me or something around those terms. I did make sure she left with resources and other agencies she can call to get a little bit more help in the home. But I did suggest that her taking care of herself more so that she's able to care for her aunt in this case, and then her mom, who's also declining in health. um, I did mention to her, trying to take time to at least walk and, look at her diet, obviously, make sure she's seeing her own doctors to make sure she's, on top of her health and treatments and things like that. So it was interesting to see, um, how she shared, like, can you believe I weigh more than her? And of course, because I feel that she's taking the toll of the stress, especially with the wandering at night and waking up in the middle of the night.
Mm.
Um, so I'll make
Of
sure,
course.
anything I learn here today, I want to incorporate and share with others. So anything else you think we could tell caregivers in terms of, handling stress, and definitely the nutrition and weight part? Thank you.
Thank you so much, and thanks for joining us, Grizel. I'm an FIU alum, so welcome. You may also want to connect with their College of Public Health, Semple College. They have a Department of Nutrition, and they do have some programs there that are specific for caregivers and seniors to help support them here locally in South Florida. But you may also want to refer people to our earlier program in this series, which did specifically focus on nutrition and some of the nutrition issues among caregivers and also their care recipients. It's not uncommon, and research does also support the notion that some caregivers do put on weight because of the experience of stress and also the limitation of time to engage in exercise. But that doesn't always have to be the case.
I just very briefly want to say that sugar is addictive. You can get addicted to sugar. And so it's really normal, because when you're stressed, you go to something that gives you comfort and soothes you.
And we had some messages in the chat. Yes, my diet weight is okay because I work out a lot. I eat dessert like crazy at night. Major weight gain. I binge on TV and dessert. Yesterday I had banana bread, carrot cake, oatmeal cookies, and ice cream. Can I come over? That sounds great to me. Myra said delicious. 100% addicted to sugar. How do you break it? And it really is addictive. Homemade banana bread at that. I don't know where my invitation is, Diane. I'm expecting. Banana bread is actually something that you can make with much less sugar, because bananas have a lot of sugar on their own. Oh, you're in California. Well, I do think that it is important, obviously, that we all look at our own nutrition, but that we're also kind to ourselves. As I've said many times before, we don't need to layer stress on top of stress, and stressing about our weight, if it isn't necessarily causing a health issue, can just pile on top of things. Myra said she loves carbs, bagels, and pizza. So do I. I think we should all have, maybe a lunch together or something. But really, the point here is that it's not uncommon for caregivers to experience a change in their diet or in their weight as a consequence of their caregiving responsibilities. But we need to be mindful and to get a handle on things before things get out of control. Much is the same for stress. And caregiver stress can become problematic when prevention doesn't occur. Same with our diet, but it's not something that we often think about. caregiving we know is incredibly rewarding, but we also know it's very stressful. So why do we have assessments for caregiver stress and caregiver strain, but very few prevention and intervention programs that occur before it gets to that point?
Well, thank you for that, everybody. Good morning. Just very quickly before I start is that you could substitute white sugar for other healthy sugars like organic honey or maple syrup, but we can talk a little bit more about that later. So, we all feel stress from time to time. Some stress can be good for you as it helps you cope and respond to a change or challenge. But long-term stress of any kind, including caregiver stress, can lead to serious health problems. Caregivers also report symptoms of stress more often than people who are not caregivers. So if you're feeling like that, that's what it's all about. So some of the ways stress affects caregivers include depression and anxiety. Women who are caregivers are more likely than men to develop symptoms of anxiety and depression. Anxiety and depression also raise your risk for other health problems, such as heart disease and stroke. As well as a weak immune system. Stress caregivers may have a weaker immune system than non-caregivers and spend more days sick with the cold and flu. A weak immune system can also make vaccines such as flu shots less effective. Also, it may take longer to recover from surgery. Now we're going to talk about obesity. Stress causes weight gain in more women than men. Obesity raises your risk for other health problems, including heart disease, stroke, and diabetes. High risk for chronic disease, high levels of stress, especially when combined with depression, can raise your risk for health problems, as I said before, such as heart disease, cancer, diabetes, and even arthritis. It's interesting, though, to note that problems with short-term memory or paying attention also can be affected. Caregivers of spouses with Alzheimer's or any other cognitive decline are at a higher risk for problems with short-term memory and for focusing. So if you're really feeling that you're something's going on, that has a lot to do with that you are experiencing stress.
So that leads us to a good question here. Does anyone recall specific memories of what you did on the day we went into lockdown in 2020 for COVID?
Elliot, I remember that time, but to me, when that happened, I had felt as a caregiver that I was already on lockdown, because remember, I couldn't do a lot of things
Sure.
as a caregiver. So I kind of felt like, the world was joining me, unfortunately. But I do remember the concern, and I was constantly looking on TV for news, and I was one of those people that went out and got like cough syrup and stuff like that, because you thought you may not have it, right? And then I was really thinking about my mother, like, what are the things that she's going to need? Because I can learn to adjust, but in her state of mind, there's probably some things that she wouldn't be able to adjust to.
Now, did you go out and buy those things the day that the lockdown was announced, or did you do that ahead of time?
It probably was around that same week. I could feel it coming, that something had to stop, that, because I remember I was going into the city for classes, and I was like, we kind of have to start really separating people. But I don't remember when exactly I started doing it. But I remember being like in the stores and seeing shelves empty of things, of toilet paper very quickly, and even like cough syrup and things like that. And back then there was so little that we knew, right? We didn't even have masks and things of that nature.
Yeah, absolutely. Thank you. I appreciate all of those comments that you made. It's triggering some memories within me of my own experience. Diane said I was in shock, went home, did nothing. Minerva wrote, I had to pack up my office and move it all home until further notice. I thought it would only take a few days for this to pass. Wrong. At first, I actually really don't remember the day that it was announced that we were in lockdown. And when preparing for today, I was trying to go back and see what date it was. But then I remembered that that occurred in different places at different times. And if you're having a hard time recalling that specific day, it's not about you. It's because, as Lucy was saying, stress and memory are linked. And I thought that this was a good example for some of us. Claudia wrote, hi, everyone. On that day, we were in the process of moving our patient to a facility. He was kind of claustrophobic, really difficult and stressful times. I could certainly imagine that. Now, stress we know actually really does affect memory quite profoundly, because stress affects how our memories are formed. And when we're stressed, more people have a more difficult time creating short-term memories and turning those short-term memories into long-term memories, meaning that it's harder to store the information when we're stressed. So stress can affect the type of memories that we form as well. If we're stressed during an event, later, the stress that we had might taint our perception, as well as our ability to recall what we perceived at the time. That's why if you watch Law and Order, eyewitness testimony is so unreliable. But it's true though. People can absolutely be sure that they saw something, but in reality, it doesn't mean that they recall it in a correct way. And a recent meta-analysis, which means a very large study that looks at all the findings of studies prior to it, was conducted on 113 stress studies. So these researchers examined many independent studies on stress and memory to determine what the most important findings across all 113 studies were. And what they found was that there's a lot of evidence that stress affects memory, and that these studies lent more support for that research. Stress can also lead to exhaustion, and this can lead to cognitive impairment that includes attention and working memory. Many of us know if we're very tired, we can't focus, we don't feel as sharp. So unfortunately, memory impairment can still be detected a few years later, even after exhaustion has been addressed. So this really underscores the importance of managing stress before it gets to that point. So I wanted to ask if anyone can relate to any of this. I know personally when I'm very stressed, I have a very hard time concentrating and remembering things.
So folks, if you're on the phone, please press *6. We'd love to hear from you. And if you're on Zoom, you know what to do. Give us your input. Always makes our podcast better. I have a little website. I can see if you've unmuted yourself.
To me, what was most interesting was that even after exhaustion had been addressed and a person was able to catch up on their sleep, they couldn't remember memories from the time that they were tired, because fatigue affects how we form memories, and so does stress. Diane said, I feel like I forget everything. Well, Diane, that might be a symptom of stress. And we're going to talk about how to improve your memory under stress.
Yeah, for sure.
It's also a big part of PTSD.
Absolutely.
Yes, you're right. Yeah, I mean, I feel very much when I'm stressed, I really feel that I'm just kind of not concentrating, and I really have to step back and use the tools that I know would sort of relieve some of my stress. So at this point, let's look at how we can improve memory under stress. There are several things you can do to improve your memory when you're stressed. Fortunately, these techniques also help manage stress, so it's a good thing both ways. One of the most important things you can do is to practice personal self-care. We keep hammering it all the time, but I have to tell you, it does work. You need to get enough sleep, you need to eat a healthy diet, and manage your stress. You know, poor sleep, high stress, and other physical problems can affect memory as well as contribute to the stress that impends memory formation. There are other important strategies you can use as well. Here are some research-backed strategies. So let's look at that. Train yourself in breathing exercise and other techniques. Okay, we talk about that. And I have to say that personally helps me. When I feel I'm stressed, I step back and I take 10 big breaths and get myself centered. One study of police cadets in training has found that psychological performance training can improve the recall of cadets who experience stress compared to those who didn't learn and practice these techniques, okay? The techniques that were used included breathing exercises, a popular stress management technique, mental performance imagery, where you actually see yourself in a place that gives you a lot of comfort. For me, it's the beach, which involves a vividly imaging practice and success attained, and you need to really try to focus. This means that when stressed, you can focus on breathing and focusing your attention, as well as imaging, and just kind of get to where you are centered. The other thing that this is what Elliot talks about a lot, get moving, guys. You don't have to go to the gym like he does, but it's so important. A study that examined the effects of aerobic exercise programs on memory impaired people found the 12-week exercise program indeed improved their memory over those who didn't enroll in the program. The subject involved in the study were experiencing mild cognitive impairment from the effects of stress-related exhaustion. So these results are especially relevant for those who are stressed. Again, you don't have to go to the gym, but go walking, exercising in a chair, dancing as I do around my apartment. All these things are very important. Now, practice mindfulness. Mindfulness is to stay in the moment. Don't let your mind wander to what was or what could be. Focus is where you are, looking at things, really looking and focusing can help your memory, not only by minimizing the stress that can be impairing it, but also by enabling better quality of sleep. One study actually, which showed that those who experience stress and memory issues often experience sleep problems, found that practicing mindfulness resulted in less stress as well as fewer memory issues and sleep problems. So what we're actually saying is like all the tools that we're kind of talking about and letting you know, they actually work through research. So I hope that some of these tips will be useful and helpful to you as well.
There's also a lot of research lately that's come out on the 30-minute brisk walk a day, having a great positive impact on memory, as well as everything else, your health, your mental status, your immune system. There's just a lot of research been done on walking, just walking.
No, absolutely right. Because walking also, you can be mindful using that tool as well. Because as you're walking, really look at what you're seeing. You'd be surprised. You could walk the same street 100 times, but if you're not mindful, it's just a blur. And if you are, you can actually say, oh my goodness, I never noticed that beautiful tree over there. Mm-hmm. Or I didn't notice that as well. So it's staying in the moment. Thank you for that, Evelyn.
Absolutely. This brings back a program we did, I think, around last year, and Glenda was facilitating and shared with us something about actually mindless walking, and that there was research, and this is true actually, that just walking aimlessly, mindlessly, with no destination in mind, just taking a stroll, how positive an effect that can have on stress. So I believe both things to be true. Mindful meditation, mindful walking, and Grizel shared that mindful meditation is great. Lots of free YouTube online videos, 5 minutes or less. Absolutely. I had to stop watching them because they were playing them on loop at my dentist's office. And after being in the chair for so long, I had enough of them. But they are great. But they are great.
The only thing I want to say, I have no sense of direction. So if I'm going to walk mindlessly, I'm going to get lost. So you have to be very careful.
Well, you just bring a smartphone with you and know how to use your
Right.
GPS and a map.
Right.
If you don't mind, I'd like to
Please.
respond to Diane's
Yes, of course.
chat. You know, Andrew Weil has evidence-based, has evidence that doing something called 4-7-8 very few times can give you that same relaxation as 10 deep breaths or belly breathing or whatever it is that you might do. And it's breathing in through your nose for 4 seconds and holding it for 7 seconds and then breathing, you know, very forcefully out of your mouth for 8 seconds. And he's got evidence that he's, you know, taken and written a book about that, and you can look it up, that actually shows that people's cortisol goes up or goes down, their adrenaline goes up, their vagal nerve gets, you know, fired up, you know, and they get rid of that sense of, you know, wanting to, you know, do something different. So you might look at Andrew Weil's book.
Thank you. I appreciate that very much. He has a lot of wonderful research and very interesting information about a lot of wellness. And Diane wrote, I hear about breathing over a lot, but I never feel like it. It makes me feel bad. Thank you.
Well, here's only 4 times. You just have to do it 4 times. And that's the
think
beauty.
Also it's different things, different strokes for different folks, you know.
Right.
Just like one diet might not be right for one person, but it works for someone else, like keto or something like that. I love my carbs. I can't imagine my life without them, but it works great for other people. Exercise works great for me. Breathing doesn't, from my experience. When I go to a stressful doctor's appointment, like Lucy was saying, I need to visualize the beach. And I actually look at photos on my phone, which I find helpful. So what works for you all? I'm curious what you do to get through specifically stressful times.
Let's hear from you folks. *6 if you're on the phone. Unmute yourself. I can see if you're unmuted on my little program here. And we really want to hear from you.
We always know that we learn as much from one another as we do from anything else and all this research. Thanks for sharing the link to the book, by the way. If you have Audible, you can get the audio book, which is great. It's one that I've listened to. My therapist has told me to schedule 2 times during the day to do breathing.
Great. Walking and gardening.
I like to actually begin the day by watering the plants because I find it helps me to just start out my day on a good note.
With nature.
Mm-hmm.
Yeah, for me, it's really music. A lot of, you know, listening to the kind of music that I like and dancing around my apartment.
Me too.
Okay, so.
Well, I appreciate everyone sharing their feedback. Myra said, I like my evening Netflix time while lathering up on aromatherapy lotions and spray. I like gardening, now going to the gym 3 to 4 times a week. It's wonderful. And we did start out with that field of lavender because aromatherapy is a real thing. And lavender, there's a lot of research that supports that lavender is very calming. It specifically can be even more helpful for individuals with dementia and Alzheimer's. And if you participated last week, we had a question from someone named Melanie, who is a former colleague of mine and a nutritionist, actually. And one of the things that has been best for her for redirecting her mom's aggressive behaviors has been aromatherapy and lavender oil. So different things work for different people. And Myra said, plus love candles, soaking in Epsom salts, and music is nice. Absolutely. Who doesn't like that? So, the thing that I always try to remind people is that it's important not to layer stressors. And it's a very simple, practical piece of advice, but many of us don't really think about it. And it's important, especially when we're dealing with a care recipient with a memory issue, that they also don't feel stressed, because we see how memory and stress are linked. So I want to leave everyone with a very practical, simple, and obvious piece of advice, but it escapes us all the time. And so this is a reminder. Don't layer stress on top of stress. What do I mean? If you're going through a tough time as a caregiver, try not to take on more stressors unless absolutely necessary. For example, maybe right now is not the best time for a home renovation or for a career change. Getting through can be good enough for the time being. I have doctoral students who are adults and caregivers, and I often advise them to pace their academic goals because of the nature of caregiving. There's no need to create hard and fast deadlines and to create more stress or overly ambitious goals or timelines in addition to other stressors. And as was said, I think a little bit earlier, ahead of the hour, we know that for caregiving, nothing stays the same. And so that's very important to always keep in mind. Now, for some caregivers, that might mean not cooking a whole holiday meal and instead hosting a potluck or going to someone else's house. For other caregivers, that might mean preparing for hurricane season so that you don't find yourself without a plan. And by the way, if you do need some help with that, you can join Lucy and I next month on May 25th as we talk about hurricane preparedness for caregivers specifically. And frankly, with the wild weather that we've all been having, planning for weather events has much more broad implication these days, especially when there are things like power failures that can be very scary for people with Alzheimer's and dementia. And if you didn't know, flashlights can be very frightening and jarring. So ultimately, it just means planning and preparing so that you're not caught off guard. And that can mean knowing that a lantern is better than a flashlight in that example. Sometimes planning and preparing for placement is also important if and when that time might come. It's always better to know your options and what they are ahead of needing to make emergency decisions. Now, in my opinion, it's good to know your closest hospital to where you live. It can also be good under the circumstances to know your best long-term care option closest to where you live or based upon your finances or other preferences. So planning is key to helping to prevent stress.
I would add, be sure you have an emergency plan for yourself so that if something happens to you, who do the paramedics call? You know, who's going to come in and take over as the caregiver? And are you prepared? Is there a list of medications and doctors? It's that planning is so essential.
Some of our caregivers shared, I'm reading from the chat, this is Grizel. Some of our caregivers shared that meeting with other caregivers to talk about their experiences helps, like support groups, but less formal. And if you'd like, you can always refer people on our way, including today. We will have an additional 30 minutes of support time that will be informal and not recorded after our program. Deborah shared, I already have memory problems, exhaustion, extreme stress over many years. I exercise, meditate, eat well, but have trouble sleeping. Is there any hope for me to recover, or is this permanent damage? What a great question. And I'm really sorry to hear, Deborah, what you're going through. Nothing is permanent. We've said that today. So I don't believe that any damage is permanent. I do think it is important, if you haven't already, to see your doctor and to make sure that you get a physical and a referral to any specialist that you might require. Lucy, do you have something that you might want to add?
No, I was just going to say it's important to go to your doctor just to make sure that nothing else has been going on. And I agree with Elliot, nothing is permanent. There is also places that you can go just to identify your sleep patterns. There are resources where you actually go there, sleep over even. Maybe there's a sleep apnea, whatever it is that's disturbing you. So I wish you all the best, but don't think it's permanent.
And Ruth Bogart asked, what does a fired up vagal nerve feel like?
What is, I didn't get that, Elliot.
What does a fired up vagal nerve feel like? Evelyn had talked about Dr. Wheel and the vagal nerve. So
Yes, yes.
The vagal nerve runs from basically your head down through your heart all the way to your intestines. So when you start charging that nerve up, it takes away from all of that blood that's going to your stress, and it's expanding your arteries, and it's making you, more of a, it's putting more adrenaline, more epinephrine, more good things, into your body to help resolve some of the stress.
kind of like exercise.
Yeah.
Thank you.
That's a good point. Okay, so I really want to go over and stress again, because that's what we're talking about, that the emotional and physical demands involved with caregiving can strain even the most resilient person, all right? That's why it's so important to take advantage of the many resources and tools available to help you provide care for your loved one. Remember, if you don't take care of yourself, you won't be able to care for anyone else. I want to tell you that I went through 10 years of caregiving, and many times I really had to set limits and see what can I do for myself. So let's look at to help manage caregiver stress. I think one of the most important things is to be able to accept help. Be prepared with a list of ways that others can help you, and let the helper choose what he or she would like to do. For instance, a friend may offer to take a person you care for on a walk a couple of times a week, or a friend or family member may be able to run an errand, pick up your groceries, or cook for you. You don't have to do this alone. Focus on what you are able to provide. It's normal to feel guilty sometimes, but understand that no one is, in quotation, perfect caregiver. Believe that you're doing the best you can and making the best decisions you can at any given time. Don't be hard on yourselves. Be realistic, set realistic goals. Break large tasks, as Elliot said, into smaller steps that you can do one at a time. Prioritize, make lists, and establish a daily routine. Daily routine are very helpful. Beginning to say no to requests that are draining, such as hosting holiday meals. It's okay to say no. Get connected. Find out about caregiving resources in your community. Many communities have classes specifically about the disease your loved one is facing. Caregiving services such as transportation, meal delivery, or housekeeping may be available. Seek social support. That's so important, because caregivers many times isolate themselves. Make an effort to stay well connected with family and friends who can offer non-judgmental emotional support. However, stick to people who are positive and not pull you down. Set aside time each week for connecting, even if it's just a walk with a friend or a phone call. Set personal health goals. For example, set goals to establish a good sleep routine. That's what we're talking about. Very, very important. Find time to be physically active on most days of the week. Eat a healthy diet and drink plenty of water. That's something I have a difficult time with. Drinking water. I'm not a water drinker. You can flavor it with different things that don't have sugar in them. Many caregivers have issues. Again, sleep keeps coming up, so you're not alone. That is something that caregivers go through. And I think as we age also, not getting quality sleep over a long period of time can cause health issues. If you have trouble getting a good night's sleep, as Elliot said, talk to your doctor. See your doctor, get recommended vaccinations and screening. Make sure to tell your doctor that you're a caregiver. Many times caregivers don't do that. Don't hesitate to mention any concern or symptoms you have. And what I want to kind of end with is that we're allowed to have bad days, okay? Give yourself permission to wallow. I do that when I feel like it's overwhelming. I'll give myself one day to wallow in my sorrow, feel sorry for myself, and then I just move forward. Giving yourself permission is okay. It's the thing is it has to be time limited so that you do not get into a depression or into an anxiety.
It's great advice. It reminds me of something that I've always sort of kept in mind, and it's a silly thing, but a comedian many years ago had said that it's really important to not always look your best, because otherwise, how will people know if you look your best? And so I think of that in the context of allowing yourself to have a crappy day, because if you don't, then how will you know otherwise that you're having a really good one? So the last point that you made about going to see your doctor is a really important one. And something that really is not talked about a lot is healthcare stress among caregivers. We know that caregivers are avoidant, that they postpone doctor appointments, but we don't talk about why that might be. So if you're feeling anxious or avoidant about seeing your doctor, you are not alone. And for many people, going to the doctor can be stressful. There's a lot of data that shows us, as I said, that caregivers put off doctor appointments, more women actually than men, but the data doesn't explore why that is. Now, many people believe it is because of a lack of available time or the need for respite, but I suspect that it might actually be related to stress as well. Now, if you're going to a doctor and if that is a stressful experience for you, then you might already be practicing one of the tips that I shared about not layering stressors.
Mhm.
I think many people who feel overwhelmed with the stress of caregiving feel that taking care of their own health can feel like an unmanageable stressor on top of a stressor. And this can be amplified for caregivers caring for someone who is ill, because you're much more aware of the impact that illness has in disrupting our life and our quality of life. So this is exactly where prevention is so important, and seeing a doctor sooner than later is critical. If you haven't had a physical or routine preventative health screenings like a mammogram or a colonoscopy, please do so. I might add that there are also new tests, for example, like Cologuard. You might have seen ads for it on television, but it is an at-home test for colon cancer that is covered by insurance and can be substituted in some cases for a colonoscopy if you're not at high risk, and if you're a caregiver and you feel like you don't have the downtime available to you right now for a colonoscopy, because we know that that requires a little downtime. So I'm just using that as an example. Healthcare and healthcare providers, if they don't know that you're a caregiver, may not consider even offering something like that as an option. But it's a really good option for people who might have unique circumstances. So I think practicing some of the strategies that we outlined to help you cope with stress is also important in the context of healthcare. And that's, again, where the prevention piece comes in. When you have coping tools, stress can become more manageable. You can also do things like writing down all of your concerns and questions so that you don't forget when you get to your doctor's appointment. And you can try to avoid things ahead of a doctor appointment that can heighten anxiety, like having caffeine, as I'm doing with my iced coffee right now. But I wanted to ask just if anyone had any comments or any thoughts about this. If you've put off healthcare appointments, what has the reasoning been for you, if you are comfortable sharing with us?
If you're on the phone, press *6. Otherwise, please unmute yourself. We really would love to have you add to the value of our podcast here.
Well, really, I want to learn, because the research doesn't tell us why people avoid the appointments. It just tells us that people avoid them. Diane said, I'm too busy making appointments for my parents. Okay.
Hi, this is Deborah Hayes.
Hi.
Hi, I had a health care scare last year with no plans for how to take care of my husband because I thought that I was very healthy, and I thought I just didn't think of that. I didn't have plan B. And so that became a really big issue for me. It became really, really scary every time I had to go to another physical exam or doctor's appointment. with fear that I didn't know what would happen to my husband if I needed to either die or, something really serious. It was a really serious health issue over the last year, and it's been resolved now, and I feel better about that. But that, I'm sure, is an issue for people who haven't got Plan B set up for the care of their loved one.
Absolutely.
And
Thank
that's
you
a big
so much.
stress.
Yes, yes,
Yeah.
it is.
Yeah.
Thank you for sharing that with us.
Yeah.
We have received a bunch of messages in the chat. Adriana said, I may need eye surgery soon, but can't travel back and forth for 3 hours each way for treatments and checkups. I care for my dad alone. I certainly can appreciate that. I have a colleague locally who was in a similar situation, and her eye surgeon, who is 3 hours away, actually coordinated with a local doctor that she was able to see for her follow-up appointments, and that allowed her to get her surgery done. It is a challenge, especially for specialty appointments. Diane said, yesterday I drove my dad with Parkinson's to the doctor. He didn't want to get out of the car. It took all morning. I can appreciate that. Brazil said, sometimes finances like copays, lack of time, may not want to find out that you're sick. I agree with all of those points as well, especially in the case for caregivers where we know that that is a financial stress as well.
There's
And
also, oh,
please,
sorry, Al. No, I
go
was
ahead.
just, no, I was just saying that sometimes some of the caregivers that I've dealt with really identified it as a form of denial, not wanting to even go there because just in case, for all the reasons that all our participants are saying. So, if that's the case for you, it's really important to put that denial aside and make sure that you are okay and that you do have a plan just in case.
And that you make this the exception to my suggestion earlier, not to layer stress on top of stress.
Exactly.
Because I do think that ultimately all of these things fall under the umbrella of stressors that make it more difficult to seek out medical care. And some people need respite. You might need respite care to make it to that doctor's appointment, or you might just need respite to recharge, which is okay. Please do not feel guilt for feeling a need to take a break. It can be as important as your role as a caregiver. And sometimes caregivers need to hear that. Everyone needs a break sometimes. It can be very hard for people to imagine leaving your loved one in someone else's care, but taking a break can be one of the best things you do for yourself and for the person you're caring for. Now, most communities have some type of respite care available, such as in-home respite. Healthcare aides can come to your home to provide companionship, nursing services, or both, but typically that is out of pocket. Now, there are adult day centers as well that care for older adults, and also short-term nursing homes sometimes take in people short-term if you need to get away, for example, and need someone to be able to provide 24/7 care for a loved one who might need it. So this is really another area where asking for help, as Lucy said earlier, is so important. You can ask a relative to stay with the care recipient. You can call 211 and ask for referrals if you need to pay for private help. Some local AAAs have lists of recommended providers they can send to you. And I know this to be true with my own mother-in-law. So most often respite care, as I said, is paid out of pocket. In some states, Medicaid does cover respite care for caregivers, but this is usually in a hospice care situation. And private individual insurance plans vary. So do be sure to inquire and to save in advance because you might need that respite care at some point. Just as Deborah was saying, emergencies pop up, things that are unplanned.
Yeah.
So Lucy, I wanted to know if you had any last thoughts that you wanted to share with us.
Well, I just want to say that I know that it's stressful for a lot of people to leave their loved one, family member, let's say in a day center or with some respite at home. I know I went through the same thing. I've always felt that I was the best person that could take care of my mother. And I had to be able to accept that maybe it won't be exactly the same, but as long as there's no risk factor, I had to let go of that. And you know, it's so important that if you're going to hire someone, or if you're going to send the individual for respite into a day center, it's important to interview the person. It's important to get references, and it's okay to go and visit a place before. But in either way, you really have to give yourself permission to be able to get some respite. And let's say, for example, if you're leaving the person at home, or you're going away, or in a day center, if you feel, I used to feel very comfortable by telling them that my phone is on, and if anything happens, I can be there within 10 to 15 minutes. That reassured me that you know, I can do this for myself. And again, emphasizing the fact that you're not the only one that can take care. And I have to tell you, when my mother did go to a day center, she had the best time ever. I was anxious, but she wasn't. When I went to get her, she kind of looked at me and like, what are you doing here so fast, so early? So give yourself permission to care for yourself.
Absolutely. And FaceTime visits can be very reassuring for caregivers at a distance as well.
Well,
Deborah
that
said,
shows our age, Elliot, you know, like you would think about that right away. And for me, yeah, that's true. I can do that too.
well, that's why we're here together. We learn from one another and
Exactly.
from our experiences. Just very quickly, Deborah shared, I've never been away. It costs around $12,000 per respite stay here in the Denver area. Deborah, I'm sorry about that. It sounds like a warm lavender bath, maybe a lot cheaper for a little bit of respite for you. And Diane asked, how can I find an adult day center? Great question. You want to reach out to your local area agency on aging. Myra, you should be up here with us. Thank you so much for answering that. If you call your local office on aging, they can provide a list, and it's right here in our resources. Why do I have a photo here of a train track? Because we know that caregiving is a journey, and the stressors that come up along the way will vary. So we really, really hope that you enjoyed today's presentation. And again, we welcome you to stay after the hour to chat with us informally. And Evelyn, I know you have some information to share.
Boy, I have a bunch of information to share because we got a new month coming up, and we have one session left this month, which is the follow-up to Dr. Jamie Heisman's presentation last month on how to get toxic people out of your life. And this one is about how to heal yourself from that. And that'll be tomorrow. It should be very interesting. I also want to tell you folks that we're going to be sending you a post-session questionnaire in a couple of days, and that will have these resources attached to it. You can always call our WellMed Charitable Foundation's customer service representative too. If you need a resource that you can't find, such as adult day healthcare, she can tell you how to get there too. And your local AAAs have all of that information with them. If you haven't signed up for this, if you got the link or the phone number from someone else, please call that customer service representative. Her number is 866-390-6491. 866-390-6491. And you'll be happy because you'll not only get those resources, but you'll get the monthly calendar. And this coming month, we have 13 incredible presentations. I'm just going to name a few of them. We have an expert in dementia, Dr. Tam Cummings, who's going to let you ask all the questions. We have self-care and mindfulness. We have a Spanish presentation on dementia and family dynamics. We have what you need to know about medications by our dear Lucy. We have frontotemporal degeneration. What is it, what it isn't, and what are the signs and symptoms? We have tips for aging in place with Elliot and Lucy. And we have caring for someone with mental health issues with Elliot and Lucy. We also have aging and sexual expression, coping with the caregiver role, degeneration. Oh, okay, this is Spanish, sorry. And this is the same as frontotemporal degeneration, but it's all in Spanish. And it's the same topic. What is it, what it isn't, and what are the signs and symptoms? And that will be given by someone who speaks Spanish, of course, and it's for Spanish-speaking folks. We also have disaster preparedness, as Elliot talked about, for caregivers. Boy, that sounds like a really good one, Elliot. An introduction to the world of emotional intelligence with Jamie Heisman. And the last one, who cares? The hidden crisis of caregiving and how we solve it. So with that, I can't thank our speakers enough. They always do so much, put so much energy and so much work into these presentations. And this has been such a fun month because our participants have done the same thing. They've been thinking and talking and telling us, what they think and helping us learn more ourselves. And I want to thank you all so much for your participation. I'd also like to thank the WellMed Charitable Foundation, a Caregiver Teleconnection, for their SOS centers, for their stress busters, and for the podcasts that they have amassed on www.caregiverteleconnection.org. With that, I am going to stop the recording. However, folks, as Elliot said, Elliot and Lucy will be staying on and having, some personal time, to talk to you folks about what it is that you didn't get to say on the call or any questions that you might have. A little support group going on. And we thank you so much and hope you have a great day.
Thank you, Evelyn, for all your input.